Hey folks, welcome back. This is episode 2 of Free My Pain Now with Dr. Matt DiDuro. All right, so just to wrap up our first episode, I had my first guest on, Miss Sherry DiDuro. Thanks so much. And we kind of touched on a couple things, but the main focus was that is, yes, you have to, pick the right doctors, ask the right questions. In today's day of age, you have to become an expert in your own condition. And it's funny, I've known you for 28 years, and I didn't ever really see you read a lot of books until you got pregnant. And then you read like 6 books. And I was like, wow, she's really taking this thing seriously. And
well, yeah, when your body's going to morph into something and create another human being, you kind of want to know what's going on.
And that's one of the reasons I picked you. I knew you'd be a good mom, a good caregiver and stuff like that. You had those really cool traits. But, the other thing is you have to become educated. You have to become your own advocate. And what I saw when you went through dealing with cancer, you did the same thing. You dove into research. You dove into internet studies. You took classes online. And I kid you a lot of times, but I say you have your own diplomat in, being a cancer patient. You went and studied and got as educated and educated me on a lot of things too. And
just wanted to be informed.
And being a diabetic, cancer likes sugar, right? When we did that PET scan, which was really to find out where the tumor was, they took a radioactive isotope and they put it into a bag of glucose or sugar, and then they inject it into your body, and they do a scan to see where that uptake of sugar is, because that's what cancer likes. So I do remember that we started doing more like a paleo lifestyle. We started really cutting out processed sugar. You did The Truth About Cancer, that series. You did a couple other ones. You started studying some of these docs. You went and got your own naturopathic oncologist. You did the grease test, which is a pretty wild test. It is a blood work that you have to send to Greece, and they look for basically circulating tumor cells within your blood.
Yeah, the cancer stem cells that broke off of your original tumor.
Mm-hmm.
So they give a measurement of how many you have in your system, because that is where the reoccurrence comes from.
Mm-hmm.
So yes, I had surgery. They removed my tumor. I had chemotherapy. I had radiation. I went through 10 months of treatment. But coming out on the other end, I don't want to get it again. So that's what the purpose of that was, to see what that number was.
Mm-hmm. And we will say that, you have to be silly, but if you don't think once you have cancer, you always have cancer.
Right.
And it's just the way it is. And it can happen and come back. So we're grateful for every day we have together. We travel. We're not waiting to be 70 years old to do our bucket list. And I implore our listeners out there that's not what it is. Like, you don't get to the golden years after retirement and then start hitting your bucket list. When we talk about Free My Pain, we're not just getting people out of pain, we're giving them their life back. And that's the thing that I really, my staff and my team, that's what we talk about. It's like, yes, we can get rid of the pain. And we have a great multidisciplinary group with 3 medical doctors, 2 nurse practitioners. We can do some of these lab tests that we talked about that aren't available here in the States.
Mm-hmm.
But again, understanding your values, not really saying, your labs look great this year. We'll see you next year. We're going to keep everything the same. And that can be, a terrible recipe for disaster.
Right.
So over the course of this radio show, we're going to be teaching you about certain lab values and what numbers to look at and understand for yourself. So I covered your story, and
Right.
and you're at a really good place now. You did away with the glucometer. You have a Omnipod, right?
I wear a Dexcom continuous blood glucose monitor.
So you
it
can look
reads-
at your phone and know exactly where your
I
blood
know,
sugar
yeah.
is.
Every
at any
5
time.
minutes, it's checking my blood sugar. So if I need to make a correction, I can do that. I know if I'm going to go low, I can correct that before it happens. So
And I do think that is the future of really keeping your own levels and knowing your numbers.
Right.
Is that I there's some of our diabetic neuropathy patients, and they have no clue what their numbers are. They're not
Right.
testing their blood. They don't like pinpricks.
Well, because if you're a type 2, most of the time, your doctor's going to tell you, oh, you can check your blood sugar once a week.
Mm-hmm.
So they're looking at, a little tiny piece of time where you probably are doing it when you've been fasting, right? So you've been asleep all night. You're going to maybe do it in the morning. But it doesn't tell you like, oh, when I have that piece of pizza, what does my blood sugar do 30 minutes to an hour later, right? Or when I have the barbecue or when I eat whatever, what does that effect have on my blood sugar? So with the glucose monitor, I can eat something and I know right away, ooh, that's going to kill my blood sugar.
What's that perfect number, Dr. Bernstein?
Well, there's this whole movement now. It's called Let Me Be 83.
Let
And
me be
83 is the magic number, which will
for your blood glucose.
There's no reason why a diabetic should have a higher blood sugar than that. But as Dr. Bernstein states, his philosophy is, yes, we have a blood sugar issue, but it's really a carbohydrate issue. So when a diabetic takes insulin, it's typically based on how many carbohydrates you're going to eat.
Mm-hmm.
But guess what? If you don't eat the carbohydrates, then you don't need to take as much insulin. You still will need to cover things. Even you eat enough salad, you're going to need to cover
still
it.
gets turned
But
into-
if you, say you're a child, you get diagnosed, they put you in the hospital, the first meal they give you when you're on insulin is like, if it's breakfast, you're going to get pancakes with syrup and here's
Orange
some juice and
Yeah.
here's this and that, and there's overload you with like 60 to 80 grams of carbs. Oh, we got to give you a bunch of insulin to cover that.
Mm-hmm.
And
And Dr. Bernstein talked about in his
it's
book
like,
when
why? If
he
you
was
eliminate the cause,
Mhm.
then you won't have a greater.
So that beautiful
effect.
pyramid that we learned about when we were in elementary school, the food pyramid, and really it's the standard American diet that is the issue. If you look at that
Sad.
acronym, it's sad.
Sad diet.
And over the last 50 years since I've been on this earth, I've seen this nation of our go to, there's 1/3 of the population is now diabetic, and probably half of the population. So there's 100 million diabetics here in the United States, and probably there's another 50 million that are pre-diabetic that don't even know it or walking around with it,
Right.
and the issues that they can have. So, that's the big thing is like, how do we understand? And what got me excited to do this radio show and podcast was that it was like my journey back to health too. Like for 4 years, we really focused on you and getting you there, and and you're a caretaker. It takes a lot out of you, and you wanna make sure your spouse is there.
I will say this though, what I've seen in your office is most of your patients are type 2 diabetics.
72% of our
Okay,
patients.
so the
that
big
walk in.
difference between a type 1 and a type 2 are actually, they're completely different. Type 1 is autoimmune disease.
Mhm.
Okay, you can't really control that. But type 2 is a metabolic disease.
Explain that. What do you mean by that?
Well, a type 2 person, most of the time, not all the time, but a lot of times, they are overweight. It is a insulin resistance issue. Most type 2s make insulin. What happens is their body becomes resistant to it. And then what that happens is they start making more insulin. And so that is the issue. So if you can lose a little bit of weight, or you become active and you watch your diet, and you can reverse that. That's something that can be reversed.
Are you talking to me specifically?
And just
to get
in
my-
general,
Okay.
but for what I'm just saying with people that I've seen in your office that have diabetic-induced neuropathy, I know that's one of your goals with them is to get their A1C
Yeah, it's
down.
the key to everything. And if
it's going to help with the neuropathy.
If your A1C is under a 9, you're going to have less side effects and issues with that problem. But really, we came back from a seminar back in March up in Nashville, and I bought a glucose monitor, and I started testing myself, and I was like, oh my God, I'm at 110, 114, and it's like, I need to start taking my own advice and getting my body back in shape. And I'm thankful to know that I'm doing some intermittent fasting, and I love the podcast because that's where I learned how to do it, the intermittent fasting, plus also incorporating the ketogenic diet, which has been very good and been around for 30 years. They started doing the ketogenic diet at Johns Hopkins to work with children with seizures and epilepsy. So that has been the core. They are also using it for cancer patients, right? We already said in segment 1 and 2 that, cancer likes sugar. And that's how it grows. So if you can cut that sugar off and starve that cancer or tumor, that's very beneficial. So, I think we're going to wrap up quickly this segment and move on to our next one, which is going to be my story and what happened to me. But to understand that every patient that comes through our clinic here in Atlanta, we treat them almost like a case study. So we know that 72% of our patients are type 2 diabetics. We know that 44% of patients have been on statin drugs for more than 6 months. And statins, we have a whole segment coming up on that. It's called statins, killing your body one cell at a time. And we have 15% of our patients who come through our clinic have had 1 back surgery. 12% of our patients are chemo-induced peripheral neuropathy. We now get more referrals from oncologists than we do any other subspecialty, meaning neurology, orthopedists, endocrinology. That's the big one. And then we find about 5% of those patients have some type of congenital form of neuropathy. So in neuropathy, we'll have a whole segment on that. That is a disease process to the periphery nerve. So if your central nervous system is your brain and spine and spinal cord, then anything off of that is the periphery. So that's really been our specialty. Okay, so welcome back, listeners. And we are talking about my story now. And, I am a chiropractor, almost 25 years now, so a quarter century. Can't believe how old we are. But really, what is age? Is it a number, or is there a way to look at that? And we're going to look at the true health of your cells and what is the age in upcoming segments. But for me, it really started, when I was a young kid, I wanted to be a doctor. I wanted to be a pediatrician. Everything I did, I worked really hard in school. I loved biology. I remember in 3rd grade, Miss Van Sickle, my teacher, she was so awesome. She pulled my parents into a parent-teacher conference and said, your son's going to be a doctor. And my mom and dad were like, oh my gosh, really? What do you mean? How? And she said, he's got terrible handwriting. And so, there's something about that, maybe the way my brain worked or the way but we do have messy handwriting. And so, as much as I did not like getting needles and shots and vaccines as a kid, I still really idled my pediatrician, Dr. Duell. And so, I love biology. I had a great teacher in Mrs. Turry in 10th grade, and I was good at it. I understood the way the body worked. But I remember when I was 11 years old playing junior league football or Pop Warner football, I made a tackle. Games were always on Sunday. And I woke up that Monday morning, and it was 1977, and I woke up with this terrible, terrible stiff neck. And I couldn't move it. I couldn't go to school. I laid with a warm compress on it. And then my dad, who owned a shoe store and had it right down the street, he came up at lunchtime and he wanted. Before that, my mom had taken me to the emergency room where they gave me a shot of Darvocet, and I threw up on the floor. And then she took me home, and that was it. My dad came home after lunch and said, "Oh, I'm taking you to my doctor, Dr. Antonucci, who was a chiropractor." And I remember this guy's name, and he had the biggest hands. And I was so scared. And I remember I was laying there, and all of a sudden, he just crunch, and I went home and took a nap, and I woke up, and I didn't have that terrible shooting pain anymore. I thought, wow, that's pretty cool. And fast forward, playing football in high school and lacrosse, and I had some other injuries my senior year, a terrible stinger, and I didn't get to play my last game of my senior year because of it. And I went to different chiropractors there, and so went on to college. I went to Clarkson University, which is a great school up in northern New York, and I was pre-med. And it was the one school that gave me both an athletic grant and a academic grant. So I was like, yeah, I'm going there. But it was a bunch of techs. It was a technical school. And I remember we were like the first class that got a computer when we started school. It was on the cover of Time. It's pretty cool. But I was pre-med there and doing pretty well, enjoyed school and labs and things like that. But I ended up getting injured again my sophomore year. I got hit from behind. I was about 19 years old. A cross check, it was a penalty. And I woke up the next morning and I had this terrible stiff neck and I couldn't move my right arm. And I was like, I went to the trainer. The trainer sent me to the orthopedist. The orthopedist wrote me a script for physical therapy because my shoulder was bad. Went back to the physical therapist. He's doing all this work on my shoulder. And he's like, man, it's not your shoulder, it's your neck. And I'm like, oh. He goes, we're going to send you to a neurosurgeon. I remember this guy's name, Dr. Mann. And Dr. Mann was the man up in Rochester, New York, where I grew up. And so I went in, and I was around Thanksgiving, and we were setting up. He's like, yeah, you're going to did some MRIs, had some bad herniated discs in the lower part of my neck. And we were setting up our pre-surgery, which was going to be right, after Christmas, and I'd have a couple weeks to recover before I went back to school. And I said to him, Doc, after the surgery, how soon can I start playing lacrosse again? And he said, oh, you'll never be able to play a contact sport again. And I was like, what? So I remember driving home in the car thinking, I got to find something else. I can't do the surgery, but I was in so much pain. And that's the thing. You want relief. And, most people are like, whatever, Doc, you tell me to have surgery, I'll do it. Right. But I had some ulterior motives to kind of still keep playing college lacrosse. At that time, there was no pro lacrosse, so that was all you could do. So at the time, my brother was just graduating from Palmer College. He was a chiropractor, Dr. Joe DiDuro, and he had picked his space out and was, wasn't even painting, had an x-ray unit. And I remember he said, well, come on down, I'll start working on you. At least we have some time before your surgery. So I went down there, drove 40 minutes to his office, and I pulled in the parking lot, had some x-rays. He did some tests, put me down on the table, and I'm like, oh, dude, don't touch my neck. It hurts so much. And he was like, made some manipulations, some osseous adjustments. And I'm like, okay, no big deal. Get in the car. I go to back up. And for the first time in like 5 or 6 weeks, I was able to like back up. I'm like, oh, something's different. At this time, I was not able to even lift a 5-pound weight. But over the next 3 weeks, I went in Monday, Wednesday, Friday, like clockwork, got my adjustments. And I remember after the first week, I was able to like lift a 2-pound dumbbell. By the end of the second week, I was able to do like a 10-pound dumbbell. At the end of the third week, I was like 15-pound dumbbell. I was excited. Went back to see Dr. Mann, the neurosurgeon, the man, and he couldn't believe it. He was like, what have you done? I've never seen anybody get better from this. I'm like, I was all excited. I'm like, Doc, I've been going to a chiropractor. And he goes, I've never seen chiropractic work for anyone. And I'm like, well, let me be the first, So it really, I switched my focus from pre-med to, biology and thinking I was going to become a lab rat or something like that. But, and my brother was like, no, you have to be a chiropractor. You have a wonderful story. And now you're working so much better. And I was lucky. I had to redshirt that sophomore year, but I ended up getting my last 2 years of lacrosse in, and was really excited. And it was a year-long rehab. to get back to playing. It was something that I really wanted to do. But during that rehab and focusing and working with my brother, I realized, yeah, this is cool. I want to offer people options other than drugs and surgery. And I think sometimes doctors, if it's not a pill or a drug or surgery, they don't think the body heals itself. So if there's one thing that our listeners could listen and hear about or take away, is that the body is an amazing self-healing, self-regulating structure, organism. And if given the right environment, enough time, your body can heal.
Right.
So, that's the thing that I've seen time and time again. And I would probably, and we're going to have Dr. Bob Bacon, who's my chiropractor now, up in East Cobb, and he's been my chiropractor the last 10 years. We're going to have him on as well, because he has this motto. It's called living the dream. And your body moves from motion. Your body lives from motion, and your joints live from motion. And it's really about getting off the couch and moving. And we talked about your cancer story earlier in one of our previous episodes. And, I've seen some great studies out there where if you want to reduce your risk of developing cancer by 50%, you actually get out and walk for 20 minutes, 5 days a week. So movement is key.
Right.
And so, it's one of the things that we want to empower our listeners to understand. But, I was talking with Dr. Bacon about our upcoming segment, and I said, I would have been disabled 4 different times in my life if it wasn't for chiropractic. And so many people out there have never even thought about going into a chiropractor. Like, oh my God, you're going to touch my neck. Let's not do that. But, when the first offer from a doctor is a pain pill, a muscle relaxer, or something like an anti-inflammatory, how does it know to go right where my pinched nerve is? How does it know? I mean, there are certain limitations in our body, and
it's true. Well, and medical doctors don't always have another option to give you. Like they can't do an adjustment, so
right. An osteopath can.
Well, a
naturopath can, and that's.
But a medical doctor can only, let's do an X-ray. Let's take this pain medication.
Mm-hmm.
They're more than likely not going to say go see a chiropractor. A lot from your experience, and this from seeing lots of chiropractic patients. Their medical doctors always would say like, "Well, chiropractic's not going to help you. They don't understand what it is. They don't know how it
works.
Don't
do that." But just stay in pain.
Yes.
Yeah.
Yes.
So we see that a lot, and it's changing. I will say, it is changing more and more. But I think that finding that area of issue. One of the things I notice is that 2% of the time the pain is coming from a tumor or cancer, right? So 97% of the time it's a mechanical stress, and if people on the radio can't see, but I'm pushing my index finger back. And when you get a bone out of place or an injury to an area, that is a mechanical stress to that joint. And there's no pill drug that is going to find that area, right? That anti-inflammatory goes through all your body. As chiropractors, we are taught how to diagnose and find that area of abnormal joint dysfunction. So a dislocation would be totally flipped back, but a subluxation, which is less than a dislocation, would just be an irritation to that joint where the thing's not moving. Like you might notice it if you can't turn your neck all the way or grip. So that's what we're talking about, is how we find that. But what's cool about our clinic is we've incorporated really a multidisciplinary staff that their main goal and job is to help eradicate the pain and suffering our patients have with chronic pain without the use of drugs and surgery as a first line of defense. I mean, our doctors still do that, but we want to look at least invasive, the less expensive things to do first before you inject a needle 6 inches into your epidermis of your spine. So with that, we're going to wrap up this second episode, and thank you.